Kowere gi mag siasa matin ni maloyo mine gana 33 oseyudo kony mar thieth mag nyithindo to kod tuochego mag oteno gi weche mago mag nyuol kowuok kuom Safaricom Foundation kaachiel kod Tend County ma Lamu. Chiegni nyamrerwa 500 ne oyudo tiegruok makamano kendo koro osemi simbego manyasani maginyalo luwo godo machiegni ahinya jogo bende koro yudo kony makamano koteno gi weche mag thieth. Jakom mar Safaricom Foundation Joseph Ogutu olero ni koro Lamu County giseketo omenda maromo kanyo $42 to kod 2 bero ute thieth kaachiel to kod miyogi mashinde.
So the program had several objectives. One was to improve access to maternal and key maternal child health services. Second was to address issues around demand for these services, because it's one thing having services available and totally another having the recipients, intended recipients, are seeking those particular services. And thirdly, we're looking at issues around coordination. So in terms of the gains made, in terms of access, there's been a lot of improvement in terms of the health infrastructure that's available. So you can imagine it's our unique geography is such that we have several islands which are far-flung. Transport on water is quite a challenge, very expensive. So the initiatives in terms of improving geographical access and reducing costs of referrals. So in terms of the health workforce, there's been a lot of capacity building of the healthcare workers. We now have about 90% of pregnant women coming to deliver in a health facility. That in itself is a remarkable achievement.
Today we are here in Lamu to share the results of a very great project that we started in 2018. As we know, Lamu is one of the 15 counties that contribute to 99% of maternal deaths in this country. In fact, it is one of the 6 counties that contribute to the greatest number of maternal deaths in this country. So we came here and we realized that there were very few partners who were involved in maternal and the child health program in this county. And together with the county, we co-created the maternal, newborn and the child health program, which we call Afya Uzazi Salama. With our partner, Farm Access Foundation and the county, we started addressing the 3 delays to care. 1, the delay to seek care, the delay to reach care, and the delay to access care. We wanted to use also technology to ensure that we are able to reach as many community members as possible. So we started reviving the community health worker. We also ensured that health facilities, either we built, we equipped, or we ensured they had the right facilities, equipment for mothers to access quality care. And then we addressed the issue of referrals. Transport in Lamu is very expensive because most of it is by the ocean and very few people can really afford. So we also worked on that, and recently we donated a water ambulance. So through this partnership, addressing the 3 delays, integrating technology and also advocacy, we've ensured that we have significantly reduced the number of mothers who are dying while giving birth, the number of newborns who are dying after birth. But also, we've increased the awareness levels in terms of communities, husbands supporting their wives to ensure they deliver in health facilities.